My name is Dr. Lakhani. I am the Medical Director at Elite Aesthetics and I have a special interest in intimate health. My disclosures are that I'm a brand ambassador for BTL for their intimate health products. I'm also a trainer for the Cellular Medical Association, so I provide training in the vampire PRP treatments as well as the O-shot and the P-shot. So today I'm going to speak to you about female intimate health and how it's growing as a specialty, and also talk a little bit about my experiences with some devices from BTL, namely the Ultrafirm 360 and the Emsella Chair, and how I'm using them in my clinic to help my patients. There's been quite a lot of interest around female intimate health, and it is an area that is growing in demand. I think what I'm finding is that women are now willing to speak about their issues more, and they're more willing to come forward and seek treatment for the problems they're having. I think the reason they're coming to us as aesthetic doctors rather than going to their doctors is traditionally there's been a reluctance for women to speak to their doctors about their situation. They've also had issues with having their needs met by health services in general, particularly in the UK. The NHS doesn't have the resources to address the issues that women have. And some of the treatments that have traditionally been provided to these ladies have been lacking in safety and efficacy as well, or they've got too many side effects. So I'm finding that as an aesthetic clinic, we've got the right demographic of patients, and if you've got the interest and the ability to provide intimate health treatments, there is a demand for them. So the kinds of reasons that women are looking for treatment for intimate health could be things like dissatisfaction with the appearance, but there are also many functional reasons why women come for help. For example, problems related to childbirth, problems related to ageing and menopause. There could be issues with sexual dysfunction, or there could be dermatological concerns with the genitalia. So, for example, the range of conditions I'd see in my clinic could be things like loss of volume from the labia, stress incontinence, vaginal laxity, vaginal atrophy, which is now called genitourinary syndrome of menopause. So there's a whole host of problems that women do actually present with, and I think that we are ideally placed to be able to help them if you have an interest in treating the area. In terms of treatment options, historically all that was available to these women was either surgery or pharmaceutical methods. But I think we're in a really exciting time now where there have been so many developments recently in our field that there are so many more treatments we can offer these ladies, from fillers to PRP to plasma treatments, and there's a whole host of energy-based devices that we have available to actually achieve life-changing results. Two of the devices I'd like to speak to you about today are both from BTL, the first being the Ultrafirm 360 and the second being the Emsella. I use both of these in my clinic to treat women with pelvic floor issues, so things like stress incontinence, vaginal laxity and prolapse, and also the Ultrafirm is brilliant for menopausal atrophy as well. So first of all, I'm going to talk about the Ultrafirm. It is a radio frequency device with specially designed tips so that you can treat both the internal and external genitalia. So the internal probe has a 360-degree treatment area, meaning that you get volumetric heating of the vaginal canal, and it means that the treatment time is actually the shortest in the industry, being only 8 minutes. The treatment involves 3 treatments a week apart, and then maintenance is usually 1 treatment every 6 months. Women find it really acceptable because they're not sitting there for long periods of time having their vaginas probed. They find the treatment comfortable, and the feedback that I've had from my patients is that they see results really, really quickly. Often, by the time they come back for their third treatment, many of them no longer have any symptoms of incontinence, and they also feel a dramatic improvement in their vaginal laxity. The Emsella Chair is the latest addition to the clinic in terms of pelvic floor treatments, and it's a really exciting treatment. It uses high FEMME technology, which is high intensity focused electromagnetic technology, to actually stimulate the muscles of the pelvic floor. So what happens in a treatment session is the patient sits on the chair fully clothed for 28 minutes, and they actually get over 11,000 pelvic floor contractions during that time. What's different between these induced contractions compared to what a patient can do by themselves is that because you're taking out the brain and you're directly stimulating the muscle's actually contracting to 100% of its ability. So the overall result on the strength of the pelvic floor is phenomenal. Patients come for treatments either 2 to 3 times a week, and they have a total of 6 in the initial course. And this is followed by maintenance once every 2 to 3 months. Again, feedback from my patients has been absolutely incredible in terms of managing all types of urinary incontinence. So the feedback I get is that by the time they finish their course, they have a noticeable improvement, and not one person has said that they haven't had any change. So the Emsella Chair is absolutely fantastic at treating the muscles in the pelvic floor. And it takes out the human element because, let's face it, none of us actually get round to doing our pelvic floor exercises. So it's a brilliant way of stimulating the muscle and rebuilding the strength. The Ultrafirm works differently in that it stimulates collagen and increases the blood flow in the vaginal canal. So it actually thickens the tissue in the canal, it improves lubrication, and it can improve the nerve supply to the area as well. So where the treatments work really well in isolation, what I find is combining the two therapies actually provides the best results for my patients. And I think we find that a lot in all aspects of aesthetics, that combination therapies tend to work better because the problem is multifactorial. So just trying to target it with one solution isn't always going to be the best answer. What we tend to do in my clinic is we actually provide all the treatments individually, but we also put them together in packages so that women can access all of them and get the best results. Now, in terms of working with a company like BTL, their technology is fantastic, and in my experience, almost 100% of the women that I've treated have seen superb results. There have been a couple who perhaps their expectations weren't realistic, or they didn't really have an issue to begin with, they just wanted to trial the treatments, where they perhaps didn't see the result they expected, but even they noticed an improvement from baseline. So I think in terms of delivering results, these treatments are phenomenal, and I find that the ladies I've treated turn into my ambassadors, and they will go out and they'll speak to their friends and they'll speak to the press. And the whole area around intimate health, which is so much of a taboo, is actually becoming less so. I think the media as well are changing their take on the way they talk about these issues. Because when I first started, the whole conversation revolved around design vaginas. Whereas if you look at the headlines that are coming into the press now, it's more about treating incontinence symptoms and trying to get their quality of life back. And I think that's a real positive step in empowering women to actually seek help for these life debilitating conditions. Just before I finish, I just want to touch on who should be doing these treatments. So I know it seems easy to jump on the bandwagon. It's in the press a lot more now, and in my experience it has been brilliant for my clinic. But I think the reason for my success is because I'm truly passionate about the area and I have a real interest in helping these women. I also think the treatments are medical. They should only be done by medical people with an experience of gynecology, because unless you can recognise red flag symptoms in the genital area, I don't think you should be carrying out the treatments. Even though they're completely safe, you need to be able to diagnose and treat the area. And then finally, in summary, I'd just like to say that it is a growing area in aesthetics. It's an extremely rewarding field to be part of, and there is definitely a lot more awareness of the options available to women. I think the key thing is to educate and empower women without causing embarrassment, and just to give them the strength and the courage and the knowledge to be able to get the treatment they need. And just to finish off, I'd just like to quote one of my patients who said to me, "It's not about anyone else, it's about me and how I feel as a woman."